I used to work for a hotel, and we didn't have an insurance company. We just had a retainership with a hospital, a particular hospital. So the disadvantage of that is that sometimes the patients might be far from that hospital. So proximity was an issue then. So I had a staff who sort of fainted. She was losing blood, and before we could get to the hospital, and the whole hospital process of files this, file that, doctor approved, my company approved, it was a whole lot. We nearly lost her, but to the glory of God, we didn't. So that made me realize, and I spoke to the management as at that time, and I said to them that it's best we have an insurance that has like different hospitals, so that even if this person is sick from their houses, they can easily go there without waiting to get to the workplace, and then from the workplace, because it wasn't far from the workplace. So yeah, that was like one major turning point for me. My name is Helen Omuzurike. I'm the HR manager for GAM Group. So GAM Group consists of Garmspot and GAM Prints. GAM Prints, we produce merch, we produce clothings for our clients. We do big scale production majorly. We also do printing, stuff like this. Yes, and what you see here. So yes, we are your go-to for designing, printing, and whatnot. So because I work with factory, or rather it's a factory, I have lots of people who fall ill from now and then. If I was not doing insurance and I calculate the costs, it's going to actually be higher. So I think insurance is important to my company because of the type of work we do and the nature of people we have with us. So yeah, it's more affordable for my company, and it's very durable, sort of. I can monitor it. I think insurance generally is safety. I'll just put it that way. That's the total term. So I know insurance covers not just health. There's also like fire insurance, the cars and whatnot. So to me, I'll just put insurance as safety generally. So insurance in Nigeria is a bit tricky. I have over 5 years experience as a human resources person, and I can tell you that for a fact that health insurance in Nigeria can be quite funny. So you have companies or insurance companies that you pay money to and they don't meet up to the expectations. So using MyCoverGenius, I actually met it when I came to start working here, and it's been very, very wonderful. The account manager is really helpful, so she makes it very easy for me. She's very responsive. So far, I recommend. She can also tell you, I usually just send like lots of people to her. When they say, oh, I'm looking for a reliable insurance company, I always say, oh, MyCover is good, and I send them to her. One of the key things that we picked is that they're very responsive. MyCover is very responsive. So when there's an issue, which is bound to happen, they are quick to moving. I've had situations where maybe the hospital, it doesn't cover whatever the patient needs, it's not covered in our plan. And Ifeoma that's my account manager, goes out of her way to like find a common ground for the hospital and my company. So so far, they are very responsive. MyCover is responsive and also very reliable. I've had people use them at nights. I even had to reach out to Ifeoma at night too sometimes. And yeah, they're very reliable. I feel very free, and I'll tell you how. So for a HR manager, it's like, it can be very burdensome for you to carry like everybody all at once. So imagine you have like 5 staff who are not feeling well, and you are the ones to maybe do the hospital, run around, get the hospital, speak to the doctors and all of that. So an insurance helps you like create a balance. So you know that, oh, these people are in a hospital. What happens there is not really you're not fully involved, but you're involved. So MyCover handles it, so I get to rest. So it gives me rest and peace of mind.